Hey guys, this is Dr. Mahajan from Mahajan Medical Center with another exciting edition of our webcast. And we got a very special guest today, a renowned cardiologist and a good friend of mine, Dr. Rakesh Sharma. Hey Rakesh.
Hey there, Ranjan, how are you?
So tell us a little bit about yourself. How long you've been in Florida, how you got interested in cardiology.
Well, to answer your question, the cardiology was always my love, and I have done cardiology training starting from Cleveland Clinic to University of Missouri, and I was a professor there for some time, and then finally I relocated to Clearwater, Florida, in 1995. So I have been serving this community as a cardiologist since 1995. Heart disease is very common, very prevalent. And once it strikes the patient, a lot of damage gets done. So it is absolutely important that each one of us take some steps to prevent it. Uh, of course, once you come in my lab, already have a heart attack, that's a bit too late, and we take care of that, of course. But I think prevention strategy is very, very important. I think the diet is very important topic. As a matter of fact, whenever I get a chance with my patient, face to face, and if they are especially very obese, I will get a commitment from them before they leave. But you got to start very simple. You got to know what are bad foods. For example, if you eat carbohydrates all day, and it is not going to be good. Even you have to watch your portion control. But it is very important. The diet is the fundamental issue in prevention of any problems, diabetes, heart disease, and so forth. So exercise is absolutely important. Not only it helps better metabolism of your glucose, improve your diabetes, it also helps your vessels, the blood vessel. They become a little more elastic, so the blood pressure goes down. It also releases endorphins, which makes you feel good. I think exercise has so many benefits, endocrinology-wise, even cardiac-wise. It should be a part of the diet, and exercise should be a part of our daily routine. Smoking cessation is absolutely important. I know it is tough. We know. I always tell my patient, one of these days you will wake up and you'll make your mind and you will quit smoking. First thing you have to make up your mind. Once a patient makes up his mind that he does want to quit smoking, it becomes so easy. But this is one of the most important risk factors we can talk about.
Right. So let's talk about the same thing in the same vein, and I don't think get talked enough is, which is more acceptable in the society, is consumption of alcohol.
Of course, if you're doing a social drinking in moderation, that is of course okay. But if you're doing heavy drinking, binge drinking, a drinking to the level which can cause actually toxicity and toxic effects on the heart, that is a problem. Remember, alcohol is going to increase your blood pressure if you're a daily drinker. Alcohol is going to increase your weight. It is going to get your diabetes out of control. So that, from that perspective, clearly you have to modify it. And if, of course, somebody is drinking heavy amount of alcohol, and that can cause liver damage.
So it's very critical, as Dr. Sharma pointed out, that if you have risk factors, you have family history, any chest pain is a heart attack, call 911. Don't worry about COVID.
If somebody has all the risk factors and he developed this new onset of chest pain, and patient generally knows it, he is not feeling well, he's feeling tightness, pain is going to the back, he's nauseous, he maybe is throwing up, he's getting short of breath, all these symptoms that are happening, and he's not sure what's going on. Well, that most likely is the heart attack. And that is the time you promptly should go to the emergency room.
Any final words of wisdom you want to give it to the patients to improve their heart health, Rakesh?
Yes. So I will say, if you think you have risk factors and you have a family history, think about it, what can happen. So modify those risk factors. That is a prevention strategy. Now, if you or in your family, somebody already has a heart attack and already have a stent, that's a whole different ballgame. Now you need to be even super aggressive, and you want to prevent another event. You want to stick to the regimen. You want to modify all the risk factors, and you want to definitely prevent a second event. We have so many resources now, it is all doable. The bottom line is that it has to have a commitment from the patient, and it is a shared decision making, and it can all work out well.
At Mahajan Medical Center, we care to listen to our patients. Proudly serving the needs of Tampa Bay in primary care for 25 years and counting.